Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Presentation of genital tuberculosis in the bladder, genital tuberculosis in urinary bladder. Okay, whenever the genital tuberculosis affects the bladder, now the bladder will show inflammation at various stages, and in the bladder you will see formation of tubercle formation is seen. What are these tubercles? These tubercles are raised yellowish or whitish nodules are seen, and these are surrounded by hyperemia. These are yellowish or whitish nodules which are surrounded by a halo of hyperemia. So this is actually a tubercle. So tubercles are seen. Slowly there is fibrosis will form in the bladder, resulting in a thimble bladder because of fibrosis. Okay. Next, in the prostate. In the prostate, large calcifications are seen in the prostate, and there will be beaded appearance of vas deferens is seen in the genital tuberculosis.
thank you and thank you for watching.